the Project Leadership Lived Experience to Lived Expertise session.
Good morning, everybody. It's working, right? We are going to get started on our next panel. This is Project Leadership, Lived Experience to Lived Expertise. And we have heard a lot this morning about the importance of bringing in people with lived expertise and lived experience into advocacy and policy making. And I'm excited to introduce this panel that's really going to focus on families' stories and their journeys, and more about how you get there. And for those not familiar, Family Voices of California offers a project leadership training program that does just that. And I guess I should start by introducing myself. I am Allison Gray. I'm the Senior Program Officer with the Lucille Packard Foundation for Children's Health. And prior to my role with the foundation, I was with the Family Voices team in the early days of project leadership when we were piloting this training, and then into its development as a statewide program that it is today, and have had great pleasure of working with all of these three panelists throughout that time period. I will just start, I guess, what we're going to do on this panel. We don't have slides. This is more of a Q&A discussion. I'm going to ask each of them questions and have them share more about their experiences. So to begin, I'll go ahead and introduce. We have Diana Vega, who is a project leadership graduate and currently at Support for Families in San Francisco, and is the senior bilingual education specialist. Then we have Catalina Chavez Tapia, who's also a graduate and trainer, and is currently the parent training manager with Parents Can in Napa. And then at the end, Kasha King, who is also a graduate and trainer, and is currently at Family Resource Navigators as the Director of Leadership and Programs. So I think we will, in the interest of time, jump right into our panel discussion. And I'm going to start with a question, then just ask each of you to answer that question. So all three of you are active advocates and have taken on various leadership roles and advocacy roles, both personally and professionally. Could you share one example, because I know you do a lot, of a systems level engagement opportunity you've been involved in, and how your lived expertise has contributed to that work? So project leadership, a main goal is a lot of what you've heard this morning, going from that individual advocacy to systems level advocacies. That's what we're going to focus on today. Diana, do you want to start?
Yeah. Well, thank you everyone for being here, and thank you, Allison. And thank you to Janice and her team for making this a reality after so many years of being online. I think I was a graduate of project leadership, like, so many years ago? I think it was 2013. So over 10 years ago. Shortly after that, like when I started the program, I thought I didn't know anything. This was not my career. This is not how I envisioned my life. But after leaving project leadership, I applied for the MCHAT panel. So there was a parent seat that needed to be filled. So I applied for it, and I've been part of the MCHAT is the Medical Children's Health Advisory Panel. And then my role has been to just bring in the issues that medical recipients or like parents of children with disabilities who receive medical encounter on a pretty much a daily, like on a daily day. So my job is to like highlight the issues. I think one of the biggest issues that I had was like the way notices were being provided to the families. It was not in their primary languages. It was not in simple language. And it was very, very difficult to understand. So finally, after so many years of like pushing back, I feel that the department just listened and sort of try to make the system a little easier to navigate for families. Okay.
Thank you, Diana. That is a great example and another example of plain language and how important that is. Yes, could you use that one? Thank you. Go ahead, Catalina.
Hi, everybody. Hello, okay. First of all, thank you, Janice, for having me here. Ms. Lisa Hooks, who's also a trainer. Like I said, my name is Catalina, and I think everything starts with a story. After working for a corporate hospital, I decided, and I always tell my students, don't get emotional, here I am. I decided to work 10 hours a month with Parent Scan, and I participated with project leadership as a parent. So I just wanted to be a parent. I didn't want to be treated as anything else. So I took the training, and then I decided that to stay with Parent Scan, 10 hours became 20, 20 hours became 40, and then I became the parent training manager. I've been teaching project leadership in Spanish for about 6 years now. And I think one of the beautiful things that I've learned from that is there's so much fertile soil in this amazing community. And so I began, teaching them. I added some cultural things to the training, and I loved it. But one of the things that I did is I began to do a mentoring group. So once they finished the project leadership training, they had all this energy. So we began and I wanted to meet them where they are. So a lot of my students have gotten their GEDs. We hire one of our staff members at Parent Scan from project leadership. But I also see these amazing individuals that need an opportunity. And I think project leadership provides that. One of the parents is coming tomorrow to advocate, and he's gone from, so many, from not really wanting to be part of their children's life to now being an advocate. But definitely the stories are amazing, and I see them in the community now being at different levels in the school system and other areas. Thank you.
Thanks, Catalina. Kasha.
Thank you, Allison. I'm excited to be here. Thank you all for showing up today. It's been a long time since we've been able to be here in this space together, and I think it's very impactful when we do so. I am Kasha King. I am a parent first. I have a now 30-year-old son. I've been in every part of the system there is, but my work started, I didn't even know I was an advocate when I first started. When my son was born, I was working in mental health, and then this position became available for CCS liaisons, so I'm one of the first CCS liaisons. I'm super proud of that. It's expanded. However, as a result of doing that work, when I interviewed for that job, this is really important to my story, is they were like, "You're an advocate," and I'm like, "What is an advocate? What does that mean?" I'm fighting for my child. I'm fighting for his needs. I'm fighting for, him to have whatever his normalcy of life looks like. And so as a result, I ended up being in a space where, I not only started thinking about my son, but I thought about all the thousands of other children like him. And so I took project leadership in 2014, and project leadership took me from a place of lived personal advocacy to systems advocacy, legislative advocacy, where I can go and talk to those who have direct impact on the services and programs that will shape how my son lives his life. And so I'm very thankful to be a part of project leadership where it teaches families how to not only advocate for your child, but advocate for all the others. Get with other families who are going through the same thing you're going through or have the same experiences that you're going through. And one of the key things that I'm very proud of was I work with Congressman DeSaulnier when CCS was going to cut funding for MTUs. And we worked really hard to make sure that did not happen. I was scared, I'm just a parent. I'm just a parent at the end of the day. But I think saying that minimizes the impact that we can have, because if we do it collectively, we're gonna make change. And so I'm super thankful that project leadership taught me how to go beyond just that lived experience and just being a parent advocating for my own son, but being able to advocate for thousands more. Thank you. Thank you.
Thank you, Kasha. And that actually leads in really well to my next question, because whether it's from serving on groups, which many project leadership graduates do, or going in talking about employment or legislative advocacy, in some cases it's working with the media. There are many, many things that graduates do. And you have stressed, Kasha, the training kind of helped you make that leap. And I would like to everyone to learn a little bit more about the how. So if there are specific skills or learnings from that experience of going through the training program and having a network of other families and having mentors and trainers across the state, what would you share really helped you get to that next step?
Thank you. I want to say, I think Jennifer was saying earlier that you don't need to be an expert on every single bill, on every single issue that's going on, because you wouldn't just, or at least for me, the anxiety of like not knowing every specifics would like kind of freeze me. So project leadership taught me like just focus on the issue that you are living. Like for example, during project leadership back in 2013, IHSS had cut, I think it was 7% of the income, and then during my legislative day, on the first time I did my legislative day, I talked to the representatives about these cuts, and some of them were like, we had no idea that this was happening. But the only way that I could talk from, it was from like my lived experience and how it affected finding a person that could like take care of my child. Also, just like Kasha was saying, I'm just a parent. I remember during my first or second meeting at the MCHAP, I was the only parent representative. And then it was here in Sacramento. We worked for lunch. We went to have lunch together. And one of the doctors, because it was like mostly doctors back then, asked me if I was a server. And I was like, I have been sitting right next to you the whole day. So it's just like the little, I don't say like microaggressions, but it's just the things that like you have to deal with. And it's like, no, I'm not the server, but I'm the parent. And thanks to us and thanks to all the people with disabilities, most of us have a job, including myself. We like the services that our children need is like from the taxpayer money. I'm gonna quote Allison on this. It's not a favor that we're asking for. It's just our right. So anyway, that's what I take back.
think for me is the idea of the ones that I'm teaching is also is understanding that they're in different stages of life. Most of them are monolingual for my project leadership class, but also in my experience is being there for them. And to me, I say, you know, I was competing with my Lisa Hooks teaching the English classes at Parent Scan. So what I did with the action plan, I gave him more time because for them, hearing the story about the movements in the United States was new. Understanding the whole process of the government was new. So being patient with them and understanding that eventually they'll be at a stage where they could become more active. So I always begin by saying, begin with yourself. Understand what are your needs. And then we're going to move into your children. Once you feel better, we'll move into your community, the schools. So having that understanding for me as an instructor for project leadership, and then also my own upbringing, coming from a Mexican-American family in Napa, where I was the only one that didn't speak English. So bringing those experiences to the table and then seeing them grow. I have a few that it's been the third year and they're still working on their action plan, but I'm there for them. I always tell them, you will always find me wherever I am. And currently I'm teaching a statewide project leadership. I have students from LA, Orange County, Santa Barbara, even Lake County. So it's an amazing experience, but what I see with them is that foundation that project leadership is doing is feeling them confident about who they are and then growing as they wish.
Thank you. I would say for me, just my takeaways from project leadership, one of the things project leadership taught me was about different bills, about the legislative, you know, like who sits where and how that impacts us as families, and where we kind of fit in there. And so I think it was really important and included in the work that I do now when I'm, because I'm also a trainer and I train other families, but it's really important to be able to understand that as a family member. You need to understand the bills that are out there. When you're going to your legislators, talking to your legislators, you have to go in. You have to be quick with, you know, like being able to, your little elevator speech. I learned that from project leadership, your elevator speech, and being able to, yes, it's one thing to tell your child's story, but be able to tell that story so that it has impact. It's touching the people that you're walking into the room with, and you're telling them about how this directly impacts the folks who are living these everyday lives. So that's one of the things that project leadership taught me that I think is very important. And then beyond that is thinking about, as you know, Catalina talked about, you know, being a Black woman, you know, growing up in specific areas. You know, I grew up in Oakland, and going into places where families don't necessarily, those families don't necessarily get the information they need to be able to take care of their kids. And so it's important that we are able to touch those families. You know, I'm those families. You know, I wasn't born with a silver spoon in my mouth, and the families that I directly support now, and I'm able to take those families and come to Sacramento. I think last year I brought like 14 families here to do some advocacy work. So teaching those families who don't readily have access, going in what I call the trenches to go get those families so that they can get what they need for their children. And these are families who are only thinking about the basic needs, right? They can't even get to that place until those needs are met. But when they learn about it, and they're like, I didn't know this. I didn't know how this bill, they know about bills and how it impacts their children's lives. So.
Thank you, Kashab. And you three clearly are very seasoned advocates. So the last question that I have, and then I hope we'll have a few minutes for questions from the audience, is some families in this room are also seasoned advocates, but some are earlier in their journeys doing this kind of work. I'm sure the Zoom room is similar. So can you share just one piece of advice for people, no matter where they are, whether this is their first health summit and they're just getting started, or if it's their 13th or whatever, like yours?
I think my piece of advice is that advocacy starts now, but it doesn't end. It never ends. So if anything, just grab the person next to you and talk about the issues that are affecting you, and then you're going to realize it's probably the same or very similar. And also, it's never too early to start, so teach your kids about this as well, because we need a new generation of advocates, and I see a lot of people that I've met throughout the years, and I'm so, so happy to see you all, Lori, Allison, Nancy, like a lot of you, and I'm sorry if I'm not like naming every name, but I do see a lot of new faces, not as many as I wish I would, like I could see after 13 years of like being from project leadership. So please, please invite our youth. I do want to say, even though this new bill is like pushing us down a little bit, we can get out of this. Like we had, what was it called? Remember, it was Healthy Children or Healthy Families. It was Healthy Families. I remember when that program was crashed, I felt like my life was going to be over, but we somehow survived. So let's not, like, this is not the end of the world. It's probably not going to be as good as we had it, but maybe it could be a little better, or maybe like slowly we can get to where we want to get. So anyway.
I think for me, one of the things I will say, if you're new to advocacy or advanced, relationships. And the first one is a relationship with yourself. And I think that working in the disabilities community has really given me the empowerment to realize that there's so many ways that separates us. But once we come together as a mom, oh wow, that is very powerful. And I've seen that in my classes, that building that relationship.
Okay, I'm going to be really quick. Simply, your story matters. Your story matters. And you're just a parent, but you're not just a parent. And so tell your stories to anybody that will listen to you, will hear you. Have a conversation next to somebody you think is important or not important. And as Diana and Catalina has said, you know, being around others and you're talking about your stories or you're mentioning something, automatically you're going to get, oh, yeah, I'm going through that too. That is where the movement happens. That's where it starts. So I will end with that.
Thank you, Kasha. And that is a perfect segue to any audience questions that we might have for our panelists. I see over here.
Good afternoon or good morning. I'm not sure which it is right now. Maybe we're just in transition, just like everything else. And speaking of transition, we're very blessed because we have two of our special needs young women who are with us today. And they are both college students, and they are both looking to how to advocate for themselves. So my question is there a possibility of having them complete a project leadership role?
So I'm hearing from down here, from the Family Voices team, that yes, they are working on curriculum specifically for transition age youth. Is that accurate? Okay.
Sorry, this is Diana. I also want to add that DOR has a program for youth. I think every year they have kind of like an advocacy group. I'm sitting right there, so if you want to come to the table, I'll give you the information because I don't know it on the top of my head.
Thank you, Diana. Other questions for our panelists? We have a question over here on the other end, Sean.
Hi, my name is Cynthia Richter, and I'm a parent of two amazing boys with autism. I don't have a question, but I just want to share something that for all of here, like equip yourself with knowledge, because knowledge is the best power, and make sure that you don't let anyone to intimidate you, and put your voice out there, because it might have a big impact with your kids, with the community, and for our broken system, we have to be heard and let them know that our kids are mothers and their family mothers. Thank you.
Thank you. We have time for one more question. Oh, right here.
Thank you, Mom. That was beautifully said, and I just want to add to that. I'm Gayatri. I'm from Fremont, California, Bay Area. I'm a mom of a 6-year-old with autism, and he is a beautiful child, and I'm so glad I got to share his photo with some of you today. I just want to say, first of all, thank you, all of you ladies, moms, for really empowering us and making us feel heard. But specifically, I really want to, and I shared this with Kasha already, but for parents who are not, or moms who are not aware of family resource navigators, 3 years ago, when my son got diagnosed and we started him with school, I felt so lost, very lost. And I think at one of these resources or fairs, I met a representative from FRN, and I connected with them, and they really saved me. They really saved me. They really saved my son, and they have brought me this far for me to really want to get involved with advocacy beyond local. So thank you, Kasha, for everything that your organization has done. Thank you.
Thank you. Thank you for sharing your inspirational stories. It's so important, the work that you do, and all of you are doing for the foundation, the Family Voice, and sharing lived experience is really a cornerstone of everything that we do, and the reason why that we continue to fund the Project Leadership Training Program. So thank you, everybody, and I think that next is lunch, correct? You have a wrap up? Okay, Janice is going to transition us to lunch.
Okay, just a few things. I do want to just add to Allison's last question. I've been taking families to legislative offices for most of my career. And one thing, we're going to talk about this tomorrow during our Family Advocacy Day for the families who are here, and just a plug for next year, if you'd like to apply and join us, you're most welcome. But one thing just to keep in mind, I think we'll talk about this, but it's not your job to be the experts when you go in and talk to a legislator. It's your job to tell your experience. It's their job to listen to you and to listen to the bills that are important to you, and you don't have to know everything. So I hope that brings down some of the pressure for tomorrow. Yeah, it's okay. Your experience is what is valuable to them, not being an expert on the details. But it is time for lunch. Actually, one more thing. We do have a project leadership cohort that's online that's starting April 8th, and we have room in that. So if you are interested and would like to sign up, please visit our website. And there are flyers on our table, I'm told. Okay, so we are going to take a full